the Driven Dental Podcast.
We're here today with Nesh, she has a unique role with us where we created a job for her, actually.
Yes.
So she's been an assistant for
around 12 years now.
12 years.
Yeah.
And her role it's in the operations team, but she's hands-on training assistants, helping every office with supplies.
Yes.
And just a general help.
Yeah.
So she was just telling me, though, she, right out of high school, kind of stumbled into dentistry. If you want to tell that story real quick.
Yes. So I think right out of high school, I was at, I had a couple of jobs before. So I worked my first job was Aeropostale. Then I went to McDonald's, and then I was there for like a year and a half. And I think I was still in high school at that time. After high school, after McDonald's, I went to Greenway Ford, and
Really?
I was the receptionist there. And at that time, I started tech school. So I went to tech school. I was doing Greenway Ford during the day. At night, I would go to school. And then when I had to do my externship, then I would work nights at Ford and weekends until I finished my externship and everything.
Wow.
Yeah, it was definitely a tough time to like manage that schedule, but I didn't have kids yet, so that was helpful too.
So after how long was tech school?
It was like, I would say around 11 months.
Okay.
Yeah.
And then you went straight to assisting.
Yep.
Okay.
Yep.
And then you worked for a larger company in Florida?
Yes,
How long were you there?
I was there for 6 years.
Okay. Mm-hmm. And what was that like?
It was interesting. Mm-hmm. It was all I ever knew, though. Mm-hmm. So I started, I started there with my externship at an office. And then after my externship was done, then I got hired there. And then around 2 months after I got hired, then they wanted to transfer me to a different office. Mm-hmm. And I was like shocked. I was like, oh my God, why are you guys transferring me? But I was the newest one. They just they needed another assistant at that office. So I went over to that office, but at first I was unhappy. Mm-hmm. But when I got there, I got to meet your wife, mm-hmm. and it was one of the best things that happened. I was there for 6 years at that office. And yeah, I think I was there and I learned everything that I could, mm-hmm. Until it was time to finally just, I don't know, grow. Yeah. Make a change and grow.
So it was just general dentistry, correct?
Yes.
Because they had specialists that really wouldn't let you assist in anything mm-hmm. different. Okay.
Yeah.
So you were there for 6 years, and then you moved to another large group for a short amount of time, correct?
Yes.
Okay. How long were you there?
I went to another DSO, and it was, I would say, less than a year, so around 10 months.
Okay.
I was there.
Was that different, though, than the first job?
Very.
Okay.
When I went to that DSO, I felt like I was brand new to dentistry for some reason. I was already comfortable at, my previous office. I already knew how it ran, what to do, what we did, what the doctor did. Mm-hmm. He was left-handed as well. So when I left there and I went to this other DSO, then it was a complete different thing. I came into this dentistry world that they were doing so many things that I didn't do. Mm-hmm. And with technology too. So right. It felt like I was starting all over.
Right.
But it was really interesting, and it opened up my eyes, and I was like, wow, there's so many more things that I can learn, mm-hmm. And grow. So I was so happy for that time in my life.
Was the issue with that group the culture
yes.
of the practice?
Yeah. The culture was very just different, and it was a lot of like you needed to meet the goals always. Wasn't very appreciative of you as well. Yeah, so the culture was definitely different.
Were the doctors kind of similar with how you worked and interacted with them at both groups?
Yeah, I would say so.
Okay.
They're kind of similar.
So your the basic assisting job didn't change that much except for more technology, different procedures.
Yeah,
Okay. So then you came to work with us at a very unique office
it was.
that was really two offices in one. Because it was two different practices at one point with two different owner docs, and we purchased both of them.
Yeah.
And so I'll let you tell the story, but if you want to talk about how that office was running and then what we were doing in that office where you kind of took over as the clear lead assistant there.
Well, let's see. Where do I start? So I started at that office after, I spoke with you. I remember the first time I met you. We went out to eat to the pizza place.
Yep.
And I met you, and it was you were super humble. You were straightforward with me. Hey, this is what, you're gonna be getting into. So I went to shadow before I accepted the job, and I saw, how the office was running at that time. It was very different from where I was at. It didn't have maybe like the systems yet. A little, just different. So I knew that there was definitely some work that that was gonna be, put into that office. But the doctors were amazing, and the staff was, I mean, that first day that I was shadowing, they were so like open, they were so helpful, and just very caring. So it was like a whole new world. The culture there was different, and I wasn't used to that. So it was refreshing. And then I accepted the job and I started. But, I remember at first it was definitely tough, and I was like, oh my God, like, where do I start? There's so many things, so many ideas that I wanted to bring to the table. But everyone was very open to it. The doctors were open to it. I remember speaking to you. I was like, Matt, like, I want to do more. Like, what can I do? And
so where did you start?
I started with the office. I started trying to organize the office. I started, seeing what areas that we can improve on to make the office and the flow better than what it was. So I started there. But I also started with the team too. Like, I needed to build those relationships with everybody. That way they can also, open up to me and trust me, so I started there as well.
So how did you do that when you didn't have a title?
I guess I'm a very also like friendly person, and I'm a caring person. So no matter what, if I had the title or not, that's just how I am. So I like to have that relationship with my coworkers. I don't like being in a place that is, having tension, or being in a place that, you don't communicate with your employees or your staff. So that's just how I was, I guess. And I started, just having a relationship with them. And from there, just, it came along with it. And they started, trusting.
So could they see you taking the initiative to get things organized, and do you feel like that's where it started?
Yeah, it started there. Like, I was there, early. I was leaving. I was the last one leaving a lot of the days. I was trying to get that office, like, completely turned around and organized, because I felt like there were better ways to do certain things. So I would ask and be like, hey, what do you think if we put this here? Or what do you think if we do this? And they were like, sure, go for it. So I went for it, and I started organizing the office as best as I
So
could.
you were asking the team
Yes.
kind of permission
Yeah.
almost, or like their buy-in?
Yes. Yeah, I didn't want to just
Yeah.
like go in and be like, we're switching this, because that's not the way either.
So if you saw something going on that was different than how you would do it or how you wanted it done, how would you approach that situation?
I feel like I would just ask them, like, hey, what do you think about this? Or do you think that maybe we can try it this way instead and see how that works? And if it works, then okay. If it doesn't, then we can go back to switching it the other way.
Right.
But that's how I would go about it.
So you basically got one half of the office organized first,
Yes.
correct? Okay. And then construction was happening simultaneously? Or was that before construction?
No, this was before construction.
Okay.
I had completely like organized it the best way I could, and then all of a sudden, hey, we're gonna have construction, and then we had to move a lot of things again because of construction.
What was that process like? Like musical operatories?
Yes, it was. It was tough at first, and then everything that I like had organized, it like I had to reorganize or just stuff it there in the meantime until we had the space or the storage to kind of redo it again. So it was just a lot of adjusting to new things.
So when was it when you started branching over into the other part of the office that you hadn't worked at, but you started working with them?
I think it started a little bit after finally the construction in the middle area was done, because that's when they had to then move into that area, and the wall wasn't separating us. We still had a relationship, with the other office, and we would go and help if needed. And obviously my husband was working right there too. So we had a relationship, but we didn't fully work with them until that middle construction was done.
Right. But they did their own order, correct?
Yes.
Until after construction. Okay.
They did their own order. They kind of just worked on their own as well. And then after construction, then before construction was done in that middle part, then I started little by little, hey, I'm going to just start placing the order for the whole office, so that I would have the other assistant that was there working with the other doctor help me out as well. And hey, I don't know what your doctor likes to use. So I would also ask for her help and see, their inventory and have her help me in that sense.
And you had worked with her previously as well, right?
No, I started.
Oh, okay.
No, because she was at the DSO that I used to work at, but she left before I was there.
Got it.
Yeah.
Got it. So at what point then did you get the title lead assistant?
So let's see. I think it took a couple of months. I started in July, and I believe I got that title, in essence, was in December. So a couple months after I had started.
So that was really before construction?
Yeah.
Okay.
Yeah, because construction started the year right after,
Okay,
like
so
January, February.
so you had the title during construction,
Yes.
but it was like two operating sides still.
Yes.
Okay.
Yeah.
So was there any conflict ever between you trying to work with the other side when they had been doing their own thing?
Honestly, no.
Okay.
Thankfully, I got along well with the other assistant that was working, next door, and she was super open and she was very helpful. And we had a good relationship, so it didn't have that conflict.
Okay.
So it wasn't, hard to help them out as well, and have that relationship so we can all work together.
Gotcha.
Yeah.
What was the most difficult aspect of it, though?
I think the most difficult was just doing inventory.
The logistics.
Yeah.
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 So how did you start to incorporate a new doctor that had their own supplies into the two doctors you had been working with?
A lot of it also had to do me talking with the doctor, and seeing what he likes, what he was like he would stand, be like, no, like I need this and this. And a lot of it was working with his assistant too. I used to get a lot of feedback from her. And that's what helped me in order to kind of bring the whole office together. And even with the hygienist too, because I was doing also the order for hygienist. So it was literally just the whole office together. I had a lot of relationships that I was starting to build as well, because the hygienists that were working over there, we all had to merge all together. And it was hard before construction because there was a wall that was still separating, everybody. But once we fully were all together, it was so much easier.
Did you have to do anything different with hygienists specifically versus assistants as far as earning trust?
I wouldn't, no, I wouldn't say that I had to do something, extremely different. It was just like, it's just different relationships that you have, but it wasn't, no, it wasn't.
What is the difference from your standpoint of ordering for a doctor versus a hygienist?
Well, definitely, it's a little bit different because since I'm an assistant, I don't know exactly what it is that the hygienists like or fully use. So it was like me learning as well, like the products that they use, why they like to use it, what it does, things like that. So I also had to learn and ask questions like, what is this for? What is that for? That way I can also help them, and also keep them, happy with what they like to use and what they wanted. But yeah, that was.
Okay. So how long were you assisting there before you feel like it was after the merge, construction's done? How long did it take to kind of smooth out to where you had your system?
I would say maybe, I don't even know, because it was the first part of construction, and then we began the second part of construction. So we had to remove, a lot of things over. And then it was a third part of construction. So it took maybe a year around there, or a little bit more, to fully have everything, stable.
Right.
And have, those systems and finally have things, that are organized. And I was only there, let's see, maybe a couple months that all the construction was done. We were finally, done with all that. And then a couple months after, that's when I got my promotion.
Gotcha.
So I wasn't there for a long time to fully have everything, I guess.
Easy.
Yeah.
Okay. So when you say organization, how much time were you spending like organizing where things were, like in sterilization, versus what is placed in the operatories? What do the assistants use so you could start to get like an efficiently run practice?
I would definitely spend a couple, maybe, I guess, in a week. Sometimes I would even come on Fridays and, try to organize the best way I knew how. And what I tried to do as well is try to get the best flow that I thought in my operatory, and then show that example to the other assistants and be like, hey, this is what I think would probably work best. Everyone's different. So
Based on the doctor?
based on the doctor,
Okay.
but at the same time, based on the assistants, because the doctor, we're the ones that give them everything. We're the ones that know and set up for the doctors. So it depends on the doctor and the supplies that we had in the room. But as far as the efficiency, it was more for the assistants. So I would get, my operatory as an example and show them and be like, hey, do you think, we can try it and see how it works? And then that's how I started. For the most part, the operatories looked the same, and were the same, had the same efficiency. But also, so a lot of the ops were also different. So it was hard to have it fully the same when the operatories were different.
Right. So part of the reason that we created this job for you is because you were able to get our supply costs into like the 3% range.
Yes.
Which for us it's a good like percent lower than other offices on average, maybe more. What do you think the main things or reasons behind that were?
I think one reason was definitely trying to treat it like it was my money, if that makes sense. Not that I wasn't getting the best products, but I tried, to also be aware of what I was ordering, what we're using it, doing the best I could with the inventory. As far as I would check the operatories, and see how much we had of certain products. That way we weren't over ordering supplies.
What was your system for keeping track of inventory?
I used to just have a little paper and a clipboard, and I would write everything that we needed. And once I wrote everything that we needed after doing inventory, then I would go into the operatories and see, and I would try to check, how much of that, we had, and then go into the sterilization or wherever we had our other supplies and see how much we had left, and then kind of come up with a number of how much we needed for the month. Because I used to try to place a big order first thing in the month, and then if we ran out of things or if we needed something by like 2 weeks, then I would place a small order for that. So that also helps with shipping costs too, that I'm, that way I'm not like ordering every week or every little thing, because the shipping also comes into that, part as well. So that was my system. I would, write everything down, go into each room and see. And
so you knew in your head how many you wanted per month per item, or did you have that written down?
It was an
somewhere too?
estimate.
Okay.
It was an estimate, but I used to write it down on the order sheet that I had, and then it was a guessing game at first until I kind of already had an idea of how much we needed.
Gotcha.
Each month.
And then you'd price shop between two suppliers.
Yes. I used to kind of compare of the two suppliers that we would get from.
When were you placing the order? Was it on a Friday or like during working hours?
Both. Sometimes it was both, but I did find it easier that on a Friday it was so much easier, especially, if I wasn't working that Friday. I would go in and then I had the time to place the order, and I wasn't rushing through or worried, okay, I have to go see another patient, or, so it was much helpful to do it on a Friday.
Right. So let's say you have a new assistant to the office, or even like a brand new assistant fresh out of school. They are there the first day. Like, what are you showing them?
Showing them around, explaining to them also how the doctor works, but also showing them, I had to show them, Open Dental, if it's a software also that they haven't used before, showing them the supplies that we use, and like I said, how the doctor works.
How do you do that with supplies and like explaining a doctor how a doctor works?
What do you mean?
So let's say like each doctor works differently, and you're explaining that to an assistant for the first time that maybe is fresh out of school and hasn't worked with that many doctors. Like, what advice are you giving them?
I give them the advice of, if you're not sure, ask. Because obviously the doctor knows too, like, let's say they're fresh out of school, they don't know how they work and everything. So I tell them, if you're not sure, ask. I tell them, take photos. I think the photos are super helpful.
Oh, yeah. That's a good idea.
Yeah, because obviously we want to have a binder now with the setup for each office, for each doctor. Sometimes that's a little tough because if you have more than one doctor at a practice, they all don't use the same things.
Yep.
But at least a basic one. But if you're not sure, definitely ask the doctor or the lead assistant, whoever it is. But that's usually my advice. Write it down. Have a little notebook. I used to train, at my previous DSO, I used to train them, and how I learned as well is writing like each little step, like call the patient back, sit them down, put the bib on them. Like that's how I remembered the steps and the things to do. And then after that, it just comes, like it just flows after that. But
how long do you think it takes for a doctor and assistant to get comfortable working together?
I think it takes a little while. I would say maybe it also depends on how the assistant is, and how quick they learn and how they learn. But I would say it takes a couple months, maybe. Estimate 2.
Reverse question. What advice would you give to a doctor on how to better work with an assistant?
That's a good question.
Because a lot of the doctors I talk to, they say that there's a lot they can learn from the assistants if they're willing to do it. So, like from what you've worked with a lot of different doctors, what has worked with getting to work with them at a good level, like quickly, and how can they help the assistant?
I think it's helpful to the assistant when they're also guiding them through, especially if they don't know how he works, or if they don't know how they work. It's guiding them through and taking that that opportunity to show them while they're working. So I think that helps tremendously to the assistant as well, because then she's listening, and she's like, okay, so he likes to do that. The assistant, our job is to anticipate too. So it's really helpful for us to know the steps that they do and how they do it, and listening while we're in the room. So you can get an idea and better know the doctor. But for the doctors, to the assistants, it's just trying to guide them and trying to tell them the reason why they're doing, what it is, or why they're diagnosing, that certain procedure.
Is it something that you have to just practice, or can you preemptively talk about this, like even before they've started working together, to just have the relationship be more on point?
I've talked to doctors too before, like to try to guide, especially if they're new, to guide them through, because they don't know yet. So I think it's something that it's good to talk about before, and for the doctors not to expect some of the assistants, especially if they're new, that they know everything, because it's gonna take a little bit of time and patience.
Yeah. I feel like talking before too almost gives the assistant permission to speak up to, say, a newer doctor.
Yes.
That's struggling, or the assistant has been doing this for a long time and has seen, they have knowledge too.
Yes.
And if the doctor's willing to learn, it's just so valuable.
Yeah. It's
So,
just talking to them and like just letting them know like, hey, I'm here to help you with whatever you need. I'm here to get to know you and how you work. So it's starting to build that relationship. That way, they're open to your feedback and you're open to theirs. We have a lot of experience sometimes, and that does help the doctors get better.
yeah.
But sometimes they may not want to listen or be open to that feedback. So at that point, then that's different.
Yeah.
But for the most part, I think speaking to them before and just building that relationship helps a lot.
Gotcha. So let's talk about one other thing. So you travel to a lot of offices.
Yes,
Okay.
I do
And
know.
you do now. What are the common issues you see when you first go into an office and maybe there's a new assistant you're training, or there's just a team there and you're just ordering with them? What are the common issues you see clinically and then also on the supply side?
I think that one of the common ones I would say is communication. A lot of the times the team doesn't communicate effectively, and just certain systems that would help their day flow a little bit better. And then as far as supplies, it depends. There's some offices that don't have, a lead assistant that is taking care of, the supplies. So I also help with going into, the practice and training whoever it is going to take over that for the supplies. That way they can do effective ordering. But I think the biggest issue is communication and in a lot of the offices. Yeah.
And you know that how?
I see it. Like I go in and I watch, I observe, but I'm going into to start building the relationships with the staff because I can't, just like when I started, at first I can't just go in and be like, hey, let's go, like we're going
Right.
to do this and this. So I just observe, and I see what they do. I see how the doctor is as well. And I start just kind of writing things down. Like, okay, I think this is an area that they would benefit from doing this. So then, like, little by little, then I start talking to the assistants. And then I start giving them ideas if they're not doing this. Like, for example, in different offices, I would let them know, hey, how do you know that, this assistant has this patient? So it's been helpful to either put the room number on the schedule. It's been helpful to put their name on the schedule. That way everyone knows and communicates and knows, even from the front to the back, that that person is with that specific patient. So then they're not double setting up for that procedure and there's no confusion. So that's, kind of the process, I guess.
Okay. So do you speak with the doctor as well if there's a
do.
communication issue?
I do. Yeah. I talk to them. I try to see too as well, like if there anything that, how it's going, if there's anything that they think that they can improve on. But I also have to build that relationship with the doctor as well. So it takes some time, but I also give them the feedback, hey, I think this would be beneficial, but it does take some time to kind of start implementing things. It has to be little by little.
Right. So as far as assistance in the patient relationship, what are you telling your team on how to speak to patients during a procedure?
I tell them a lot that it's really helpful for us to kind of read the room and see how the patient is and how they're feeling. I think that, us as dental assistants, we know and we see how the patient comes in and how they are. So we can kind of read them already. So I think it's also helpful if, we see that the patient's anxious, that we go over everything that we're going to be doing today, give them the opportunity to ask questions, so we can explain and educate the patient on everything that is going to happen throughout their visit. I feel like when I started, with Operation Dental, that was a big, I guess, difference, because before in the previous DSOs that I worked at, they didn't have that relationship with the patient. It was more so get in, get out, let's do this and go. But here I had to learn how to build a relationship with the patient, not just do that, make them feel, comfortable. And that is also something that I have spoken to other assistants about, to let them know, like, hey, just go through it and make sure that they know what we're doing and that they feel comfortable with you, because it's a big part of their experience as well. And it also helps, the practice itself, because it makes us stand out.
Now, were you presenting treatment plans?
I did for a while.
Okay.
I did. And then we started having like a treatment coordinator. And then for bigger procedures, then, the front would come back and present it. But we did. We presented everything, like crowns, root canals, extractions.
So what's some general advice you have if you do work in the office where the assistant is presenting treatment?
I would say, one, learn a little bit about insurances and how they work. Because the patient is you will have some patients that will be like, well, why am I paying this? Or why do I have to pay a deductible, or things like that? So I think it's getting a little bit familiar with the insurance part of it if you are presenting treatment, the breakdown. That way you have a little bit of knowledge as far as that, and what the practice offers as far as like payment plans or in-office plans that we do offer. So getting familiar with that before, if you have no experience, and then, before you present a treatment plan. And also start shadowing. So if you see the front presenting, stay in the room. That way you listen to see how they present the treatment, and what they say. So that would be my advice.
If you have an assistant who's nervous to talk about money, like how do you address that?
It's hard to talk about money. But again, it takes the knowledge that you have and the confidence. The worst thing that the patient is probably going to say is like, no, or, so letting them know, like, hey, if you're nervous, do the best that you can. If they give you pushback, then, go to your office manager and say, hey, this is, what's happening. I think they're not wanting to do it because it's too much, or they're having, questions regarding insurance. So then they can go back and they can present it. And then from there, you listen to see what it is that they're saying. That way you learn how to manage that situation if it comes again later on.
Right. So what are some ways assistants can better help the front desk and just everything they're doing?
Honestly, cross-training helps a lot. When you are knowledgeable with the insurance part, that's a big help already, because you notice little things like, you notice that now you have to look for missing tooth claws and, deductibles and all that. So I think that's really helpful. But Also, if you're cross-trained in the front, you learn how to complete the appointments and send out a claim. So on the time, like if you do have time on the days that you can cross-training with the front, I think it's a big help because then you're in the back. You learn how to close out the appointment for the day. You learn how to send the claim. And then if there's no one available in the front that can check out your patient, you learn how to then take payments. I think it's always good to just, let's say, just collect what we mentioned in the treatment plan or whatever the amount is, rather than under collect. And if you make a mistake, that's it. Like, you learn from it, you do better for next time. But I think it's really helpful for the front. I've gone to different, offices, and, I'm able to either help them checking out or help them with the phones, because I know how to answer the phones and how to schedule everything like that. So it's really helpful to the front when the assistant knows.
How important is it to know how long each procedure takes for a doctor for scheduling effectively?
Oof, it's very important, because that kind of either sets you up for success or that day is going to be just a little crazy. So once you fully know how your doctor works, then you're kind of able to gauge it by that. It's definitely a work of art. The scheduling.
How do you begin to balance that? Let's say you have a doctor who's not as busy as they want to be, but you also don't want to push them to be like stressed out. So how do you find that balance? And like if there's issues in the day that come up, how do you remember to breathe and just get through them?
I think just understanding, like, we're going to have these days. It's going to happen. But you try to also guide the doctor through it. Hey, this is what we're doing. We have this time, available. We can do it today. Or, hey, we have this patient that's here right now, but this other one is coming. I don't think it's going to be enough time. It's a lot of trying to guide the doctor as well.
Right.
Through the day. So they're not like, oh, but we're not wanting to do this, or we can do this. It's a lot of guiding and communicating with the doctor. Like, hey, I think, we can do this right now. Let's do it. Let's get it over with. That way we can go along with our day.
Do you prefer the front desk ask the assistant first in the perfect world? Since the assistant knows if they can do it or not, and then it's up to the assistant to talk to the doctor?
Yeah, I think so. There's some instances that the front will also just go straight to the doctor, and some doctors, they're like, nah, we can do it, and then it flows fine, but the assistant does know a lot of the day and how, or, when you're at a practice that you're working with 2 doctors and you have limited, chairs available, that was an issue that we also ran into, because the other doctor would be like, oh yeah, we can do it, no worries. But it was like, but we're not going to have the chairs available, or it takes longer than we thought it would. So then the other patient comes. Now the other doctor is like, I don't have a chair, So it takes some trial and error, but it's just learning how to read the schedule and how long things will probably take. It's going to happen. There's going to be, days that we are going to run over. But to try to make it less than, it should.
Yeah. So let's say you have a brand new doctor come into a practice. What does that first week look like with them?
That first week looks like a lot of talking, a lot of you know, qu- um, asking them questions, asking them what things, they like to use, how they like to, in essence, work. I've had the experience to work with a doctor, newer doctor. It was definitely challenging. And you have to have the patience as well, to just learn, because you have to understand that they're also new at this and they're trying to also find their way. But if they're open to it, you're able to guide them as well. So it's definitely a lot of talking and trying to see their perspective and understand, so you can help them how they would, want to be helped.
Yeah. As far as being a team player, like if you're in an office with how many people? Where you're 20?
Yeah.
What are some of the biggest issues you saw, or like complaints, and then areas that you can look for to really prove that you're a team player?
Let's see. There were sometimes issues with maybe, somebody didn't take care of this, or, the dishes were not done, or things like that. So being a team player, you have to kind of stand out and go and take out the trash, go and clean the other person's room, go and clean the dishes, go in and do the instruments. And I think a lot of it too is, before you leave the practice, go ask, like, hey, do you need anything else? Are you okay? Do you want me to help you with anything? Because it does help, and it does make the other person feel like, oh wow, like she's so helpful, and you are, because you're a team player. You're trying for everybody to,
Right.
work together.
Yeah.
Sorry, my headphones are falling.
That's right. As far as being a team player and like working with the front desk on scheduling, let's say, because I feel like there's room for tension when the front maybe overschedules the back.
Yeah.
It's not, maybe it's the doctor's not even part of the conversation, but it's assistant, front desk. How do you suggest handling those situations and avoiding them?
Talking to both, but talking a lot with the office manager. I think it helps, and explaining to them, hey, this, how the doctor works too, it's a big part. But explaining to them, like, hey, I think this has been a little tough for the back, or we're running, a lot behind because this is being scheduled here or there. So it's like coming up with a game plan with the office manager, and seeing, where there could be better efficiency with the scheduling. That way everything runs smooth from the beginning till the end.
Yeah.
Yeah.
Are you looking ahead at the schedule the next day?
I do. Well,
Or suggesting you do?
yeah, definitely. Well, now a lot of the offices are doing chart preps, which is, a big deal too, because you kind of have already what's going to be coming, and what things are needed for the next day. But yes, I would sometimes look at the whole week ahead. If it's Monday, I would look at the whole week,
Right.
and kind of see what's coming, but definitely for the day.
So what are you looking at when you're chart prepping? What are you looking for?
We have to look for x-rays if they need x-rays. We have to see if their note was previously done, what they're coming in for. What else? If their case is here, which is, a big part as well. That's pretty much it. But those little things, it helps, because then if you look to the next day, you can see like, oh, they're coming in for, this procedure. Do we have the case? We don't have the case. Oh, so now we have to either reschedule the appointment or call the patient, things like that, call the lab. So you get to find out a couple things before.
Right. Let's say you're dealing with a super difficult patient. Do you have any general advice on that one?
Listening to them, a lot of the times the patient just wants to be heard. And that's what we can do. So I try to listen as best as I can. I try to explain to them. If it's something that, I don't think I'm going to further help with, then that's when I'll either call the doctor, because they tend to listen to the doctors a lot, and or call the office manager and be like, hey, this is what's happening. There's nothing else I can do
Yeah.
moving forward. This is what I have said, what I have done and explained. And then I kind of give it to them.
Right. Yeah. And have you come across like obvious situations where a patient needed to be dismissed?
Yeah.
And how do you suggest going about that if you're an assistant who went through something uncomfortable or whatever the situation is?
What I've done, I've spoken to the doctor and, hey, this is what happened. They were super rude. And it made me feel very uncomfortable. And then, also with the office manager there, spoken to them and they kind of come up with that decision, and then, okay, then that patient needs to be dismissed,
Right.
It always depends obviously on the situation, but that would be the best way. Or if it's too much, then, I can sometimes ask another assistant, like, hey, do you mind switching with me? Because, this is going on and I just don't feel comfortable. I had a situation like that before, and I was like, I can't see that patient again. I can't. It's too much. And then that's it. If the patient wasn't going to be dismissed, then it would be another assistant then taking over.
Gotcha. So let's say you're an assistant, you've been an assistant for a year or two or however many years, and you want to transition into more of a leadership role, lead assistant or whatever that looks like in your office. Where do you suggest they start?
I think it's really important when you show the initiative. But I think a lot of it is being a team player. And sometimes you kind of have to sacrifice, your time, sacrifice some things in order for you to grow and for everyone to see what you're doing. There's times that you may think that no one is noticing what you're doing, but then they are, they do see. So a lot of it is definitely teamwork, trying to go above and beyond of what you have to do. That way they see that, and then they start, they just start looking up to you, and they start trusting you and asking for your help. Being available is always important too. Because if they come to you and you're like,
Right.
I'm busy, or, kind of shoot them away, then they're not going to feel appreciated, So I think a big part is just teamwork and initiative, which is something that it's hard to find sometimes. A lot of, people, not just assistants in general, they don't show that initiative and that want. But they say that they want to grow, but they don't really show it.
Do you notice any difference in work ethic before COVID and after? Or is it just me?
I think that there's definitely been yes, I've seen a difference.
Yeah.
I think it's been hard to also find good employees. I don't know why, but it's been hard.
It's definitely easier than it was. But I would say 2021, 2022, it was just a very strange environment. And it's just a different environment now. In dental, it seems, where it is harder to find hungrier employees.
Yes. Yeah.
So,
I don't really see it often as well.
Yeah.
And they're like, oh yeah, I want to do this, I want to do that. Well, then start, with the basics first, and then you start growing. I had a lot of learning and growing to do myself, so you learn each step of the way.
Yeah. Well, hopefully the people who do want to grow listen to the advice you gave. I think you said some really awesome things, and I really appreciate you being here.
Thank you.
And going to all the offices and doing what you're doing. It's nice to have that, to know that that's happening in the background now for the first time. So I sleep
really
a little
cool.
better at night.
Yeah. Well, thank you. It's been awesome. My job title, my job role, it's been something that I've been wanting to do for a long time. So it's been great, like getting the opportunity and seeing all the other offices and how they work, and meeting all these employees that we have, and the staff and the doctors, and just working with them and building those relationships. It has also made me a better leader. So I'm very thankful.
That's awesome. No, I appreciate it. Thank you so much.
Thank you.
All right.